Learn about addiction, a problem humans often have, making us want things that make us feel good. Some people can control enjoying certain things, but for others, it becomes a big problem. For example, work can be an issue. Many can stop thinking about their job when it's time to finish, but for others, it becomes everything they think about. Even a simple thing like having coffee every day can cause problems. If you miss your coffee, you might get headaches and feel grumpy. Because we're so easily drawn to addiction, scientists want to know why. In the late 1960s, a study tried to find out why we struggle with drugs. Instead of studying people, they focused on animals, using a strange setup to let monkeys give themselves drugs like cocaine and meth. The study was scary for the monkeys. Some had overdoses, body issues, and mental problems. But the study only confirmed the obvious. Addictive drugs are addictive. The study became famous, but not in a good way, because it treated the animals badly. Today we're talking about the 1969 monkey drug trials, a study where monkeys were given drugs. In June 1969, 3 scientists released a paper about their study. People didn't like it much. The scientists showed off a device that let animals give themselves drugs. But let's go back to Morris Sievers. He started studying addiction in 1928. He was interested in how drugs affect our minds and bodies. After some time, he moved to the University of Wisconsin in 1930, and Morris Sievers followed him in 1932. Together, they studied drugs like opiates and cocaine. Sievers wrote many papers in the late 1920s, supporting a new idea about opiate addiction. His experiments involved testing on dogs, cats, and monkeys to understand addiction better. In the 1930s, Sievers developed a way to measure the effects of withdrawal in animals. He used dogs, rats, and monkeys for his studies. The National Research Council wanted to find a non-addictive morphine, and Sievers' work was essential for that. By the 1950s, Sievers' research wasn't as important, so he changed his experiments. Instead of giving 1 dose a day, he tried multiple doses like a human might take. Later, he let animals give themselves drugs, leading to the monkey drug trials. Morris Sievers conducted experiments in the 1930s to understand addiction. He tested on dogs, cats, and monkeys to explore the connection between psychological tolerance and physical dependence. He coined this as the dual action theory. Sievers considered the link between the pleasurable feeling, high, from a drug, and the avoidance of withdrawal in human addiction. Taking inspiration from Harry Harlow, he believed that addiction in animals is a learned response associated with positive sensations. To create addicts in his experiments, Sievers used a 7-day dosage schedule, starting with a small dose and gradually increasing it. After a month, the subjects exhibited noticeable behaviors, showing excitement during injection times. They even displayed submissive body language toward the drug administrator. In the 1930s, the National Research Council aimed to find a non-addictive morphine derivative, boosting Sievers' studies and funding. However, with the onset of World War II, this search was put on hold, impacting Sievers. By the 1950s, Sievers' research became less relevant. Seeking to adapt to a more behavior-driven model of addiction, he revamped his experiments. Instead of a single daily dose, he mimicked a more human-like dosage with multiple doses in 1 day. Sievers further modified his experiments to allow animals to self-administer, eventually leading to the infamous monkey drug trial. This is a brief overview of Sievers' work, and a more in-depth exploration of his studies is recommended for a fuller understanding, despite the sadness associated with the treatment of his subjects. Involved a collaboration between Morris Sievers, Gerald Dinu, and Tomoji Yanagita, conducted at Michigan University. The aim was to explore drug addiction, specifically focusing on non-physiological substances, drugs that don't cause physical withdrawal but can lead to psychological addiction. Given the challenge of modeling this type of addiction under Sievers' dual action theory of drug euphoria and fear of withdrawal pain, the team focused on substances like morphine, codeine, cocaine, diamphetamine, pentobarbital, ethanol, and caffeine. To test the psychological dependence caused by drugs like cocaine, a method of self-administration was necessary. This method had been previously tested on rats in a 1962 study by a scientist named Weeks. Weeks pioneered a conditioning method where rats could self-administer morphine using a lever, maintaining a dependent state similar to human addicts. Another study in 1964 by Thompson and Schuster used intravenously delivered morphine in restrained monkeys, aiming to understand the reinforcing capabilities of morphine compared to food. However, they didn't investigate if they could create an addict from a spontaneous lever pull. For the Sievers, Dinu, and Yanagita study, this method became the basis for a drug delivery system in monkeys, but with a wider variety of drugs. The crucial aspect of the experiment was to determine whether, after the first drug injection through a spontaneous lever press, the monkeys would continue seeking reinforcement by increasing lever presses and maintaining a pattern of self-administration over an extended period. Each monkey was housed in a small cubicle with specific dimensions, and the floor featured a mesh screen with a pan for easy cleaning. The cubicle's back wall had a panel with two switches crucial for testing the animal's drug dependence. The first switch, when activated, administered a dose of the drug to the monkey, while the second produced the sounds of a dose, but only returned the drug to the reservoir, serving as a control mechanism. To determine if the monkeys were seeking the drug or merely playing with the switch, the researchers implemented several measures. The two switches on the cubicle's back wall were swapped randomly at intervals. A drinking fountain was provided next to the switches for water. The drug infusion machine had versatile controls, including programming for dose delivery and manual control, in addition to the operant control from the switch. Monkeys were intravenously connected to the drug infusion unit via a catheter terminating at the right atrium of the heart. A metal harness, connected to a restraining arm allowing movement around the cubicle, held the animal and catheter together. Administering the drug took 25 seconds, and an additional 25 seconds were required for syringe refilling, limiting the number of doses. The machine could deliver a dose in 4 ways. 1. By the monkey alone. 2. By automatic timer. 3. By the timer if the monkey failed to press the lever within a predetermined time. And 4. By the monkey, with a timer blocking the circuit after injection, preventing the monkey from taking the next dose until a predetermined time had elapsed. Monkeys, selected from a pre-established breeding colony at the university, aimed for weights between 3.1/2 kilograms to 4 kilograms. After acclimation for 2 to 4 days, the subject underwent surgical implantation of the catheter into the jugular vein under barbiturate anesthesia. Post-surgery, saline solution was injected into the catheter every 3 to 6 hours for approximately 5 days until the wound healed, making the subject ready for experimentation. After fully recovering, the monkey was introduced to the switches in its cubicle. Initially, the active switch could only administer a dose of saline solution. A signal light above the switch visually indicated to the monkey that pressing the switch would result in a dose. A baseline was recorded over the next few days for the number of times the subject pressed the switch for a saline dose. After the control period, the test drug was introduced for the first time. Most subjects either continued pressing the switch for saline or lost interest after a few days. For the latter, introducing the test drug was facilitated by providing an incentive: raisins taped to the switch. After the first positive response to the drug, only 2 to 3 raisin incentives were needed to condition the subject to the lever pull equals drug mechanism. As multiple monkeys were involved, not all responses to the drugs were positive. The automatic dose function of the machine played a crucial role. If a monkey didn't initially take to the test drug, potential dependence could be induced by timed intervals of drug administration. If the animal developed a positive preference for the drug, an increase in self-administration would be observed. However, if after 1 month the monkey didn't show a preference for the drug, it was deemed that the animal hadn't developed a psychological dependence on that particular substance. The experiment comprised multiple individual studies for each substance. Here are the outcomes for each substance, listed from best to worst. Nalorphine. This study lasted only a month, as none of the participants initiated self-administration, and after automatic doses, withdrawal only lasted around 2 days. Caffeine. 2 out of 4 monkeys failed to initiate self-administration of caffeine. 1 initiated, and 1 failed to initiate self-administration, although priming with automatic injections caused the latter to begin self-administration. The pattern of self-administration of caffeine was sporadic and irregular, resulting in no deaths or noticeable withdrawal. Morphine. This experiment lasted a long time, involving 11 monkeys. 3 failed to self-administer, but after encouragement, all became drug-dependent. During mechanical failures, the monkeys showed withdrawal symptoms, pushing the lever frantically to get another hit. The study lasted for 16 months, and despite being morphine addicts and appearing dopey compared to their control counterparts, the general health of the participants was good. Participants increased their dose for the first 7 to 8 weeks, eventually evening out, with 1 monkey increasing the dosage for 30 weeks. No deaths occurred during this substance study. Outcome not mentioned. Amphetamines. All 5 of the monkeys initiated self-administration and not long after showed signs of hallucinations, plucking the fur off their arms, but none died. By the end of the study period, the participants were noticeably affected. 1. Cocaine. 4 monkeys were used to study the effects of cocaine, with initially only half beginning to self-administer. After 30 days, 1 monkey died of an overdose, leading to the implementation of limits on the amounts of cocaine. Following the 30-day period, the monkeys became withdrawn, stopped eating, and showed signs of hallucinations. Some bit off their fingers and scratched their skin. They pressed both levers and were noticeably confused. 2. Ethanol. 4 out of the 5 monkeys in this experiment initiated self-administration, but for the first few months, self-administration was interrupted by days of voluntary abstinence. These gaps reduced as time went on, and the reactions from the animals were similar to what would be experienced in a drunk human. Drowsiness, lack of spatial awareness, and tiredness. During withdrawal testing, the animals became sick, experienced tremors, and even showed signs of hallucinations. 2 monkeys died, not from overdose, but asphyxiation during sleep from respiratory obstruction. 5. Codeine. This involved 5 monkeys and only lasted for 8 weeks. 4 started self-administration, with only 1 needing initiation by the use of automatic doses. The dose rate increased as each subject continued to self-administer, but after 6 weeks, the first monkey died due to convulsions from an overdose. By week 8, all were dead after severe convulsions. The aftermath. The experiment highlighted interesting results. Previous experiments had used psychologically dependent animals exposed to the substance via operant conditioning, where 2 mechanisms of self-administration were thought: avoidance of withdrawal and the animal preferring being under the influence. The 1969 study, using non-psychologically dependent animals naive to the effects of the drugs, showed that addiction, in this case, was chosen by the subjects to keep themselves under the influence. It is indeed a complex ethical issue. The study provided valuable insights into drug addiction, shedding light on the psychological aspects of dependency. However, the controversial and arguably unethical use of animals in the experiment raises serious concerns. The Helsinki Declaration emphasizes the importance of respecting the welfare of animals used for research, and the reported trauma inflicted on the monkeys is troubling. The ethical implications are further amplified by the fact that the study's results, while significant, confirmed what was already known. Addictive drugs are addictive. On an ethical scale, rating it around a 4 seems reasonable, considering the scientific knowledge gained at the cost of animal welfare. Ethical considerations in scientific research are crucial, and the study's controversial methods warrant careful scrutiny and reflection on the balance between scientific progress and ethical responsibility. In summary, the 1969 monkey drug trials revealed insights into addiction, but ethical concerns persist. Let's discuss your thoughts on this controversial study in the comments below.